So there's a new pain medication that was just FDA approved this January 2025, and it allegedly rivals the efficacy of opioids while being a non-opioid. So let's talk about that. So if you're new to this channel, I'm Dr. Mizan. I run Mizan Coaching LLC. Please like and subscribe and for up-to-date medical information. And if you need medical coaching or anything else, just check the description to contact us. All right, so this medication is called Journavx, which is a funny name. I have no idea why they called it that. They could have gone for something a lot more, you know, like memorable or easier on the tongue. But the chemical name is called Suzetrigine. It was approved by the FDA just last or 2 months ago. It's March right now, so January 2025, and it's a new non-opioid pain medication for adults with moderate to severe acute pain. It acts by blocking pain signals in the peripheral nervous system without the addictive potential of opioids. So, how does it do this? It basically acts on sodium channels. And for those of you who know me, I've been a medical legal consulting physician and a medical coach for over 4 years now. And what I do is that I find the most up-to-date medical information and present it on this YouTube channel. This is really just a hobby of mine. But this really shocked me because there were literally no signs of anyone creating a new pain medication. And, I think the reason, the impetus behind this is the fentanyl crisis. Like, I really do believe, as, just as an aware physician that's out of the clinical space, I think in the United States and parts of Canada and, all over the world, really, like, there's a ton of opioid addiction that, should have been avoided. Either from the source or from, more illicit like sources. But what I mean is that a lot of healthcare systems just give opioids like candy. Like, literally, patients are just given morphine if they have like leg cramps. And it's something that I've been advocating since I was an intern in residency, that there's no need to just automatically give opioids, right? Like, those of us who've had severe acute pain, yes, it sucks, and maybe a couple sessions of very low dose opioids is fantastic. However, all opioids, and I need to stress that again, every single opioid, even oxycodone, Percocet, whatever, every single one has the potential for addiction. And there's even documented cases of patients taking just one pill of anything, really, and developing a lifelong opioid addiction. So we've always had NSAIDs like Advil and naproxen, and we've had Tylenol, which is acetaminophen. We've had these for a long, and it's called paracetamol. Paracetamol and acetaminophen are the same thing. Paracetamol is just the chemical name of it outside of the U.S. So for all of my international or European and Asian and South American, Central American audience, like, that's paracetamol is acetaminophen. Anyway, so we've had acetaminophen, we've had or paracetamol, Tylenol, we've had Advil, naproxen, Aleve, these NSAIDs for a very long time. But the issue with these is simply that they're not strong enough. Like I remember when I fractured, when I had a bone fracture, and it was severe pain. I underwent 2 surgeries in my life, both of which I was in, I would say, 9 out of 10 pain. 10 out of 10 pain is like severe, like it's childbirth. Childbirth is 10 out of 10 pain. Anything less than that is 9 or below. Anyway, so Tylenol, Advil, basically, these are what's called COX inhibitors, so COX inhibitors. So they work on the COX system, and the COX system is basically a pain modulation system, and it works by basically sending out inflammatory cytokines and all this stuff. So Journavx or Suzetrigine, and I'll link all my resources below, as I always do. But this is a brand new thing, so let me just read the FDA article. And if you do have any questions, just pop them in the comments below. I check my videos every day, so And a lot of you are longtime viewers, so thank you so much for subscribing and for commenting and liking our videos. It really means a lot. Okay, so this is from the FDA.gov, so it's the official FDA article on this. So FDA approves novel non-opioid treatment for moderate to severe acute pain. The first drug approved in a new class of non-opioid pain medicines, the agency continues to take steps to support new approaches for pain management. So this was published January 30, 2025. Today, the U.S. Food and Drug Administration approved Journavx, Suzetrigine, 50 milligram oral tablets. And that's another amazing thing. It's only, number one, it's only 50 milligrams, so it's quite small. And number two, it's oral. So no need for IM or intramuscular injections. No need to go to a hospital for intravenous or IV, medications. It's an oral 50 milligram pill. Okay. So Suzetrigine is a first-in-class non-opioid analgesic. Analgesic just means pain medicine or pain medication to treat moderate to severe acute pain in adults. Journavx reduces pain by targeting a pain signaling pathway involving sodium channels in the peripheral nervous system before pain signals reach the brain. Journavx is the first drug to be approved in this new class of pain management medicines. Pain is a common medical problem, and relief of pain is an important therapeutic goal. Acute pain is short-term pain that is typically in response to some form of tissue injury, such as trauma or surgery. Acute pain is often treated with analgesics that may or may not contain opioids. The FDA has long supported development of non-opioid pain treatment. As part of the FDA overdose prevention framework, the agency has issued draft guidance aimed at encouraging development of non-opioid analgesics for acute pain and awarded cooperative grants to support the development and dissemination of clinical practice guidelines for the management of acute pain conditions. Yeah, and then Dr. Jacqueline Correa wrote, today's approval is an important public health milestone in acute pain management. She's the acting director of the FDA's Center for Drug Evaluation and Research. Quote, a new non-opioid analgesic therapeutic class for acute pain offers an opportunity to mitigate certain risks associated with using an opioid for pain and provides patients with another treatment option. This action and the agency's designations to expedite the drug's development and review underscore FDA's commitment to approving safe and effective alternatives to opioids for pain management. The efficacy of Journavx was evaluated in two randomized double-blind placebo and active controlled trials of acute surgical pain, one following abdominoplasty and the other following bunionectomy, so removal of a bunion. And abdominoplasty is sometimes like tummy tuck or removal of skin from the abdomen. In addition to receiving the randomized treatment, all participants in the trials with inadequate pain control were permitted to use ibuprofen, Advil, as needed for rescue pain medication. Both trials demonstrated a statistically significant superior reduction in pain with Journavx compared to placebo. Okay. So this is really just saying that Journavx reduces pain. That's what it's saying. And the patients or the the research subjects were also given the option of using Advil as well. So if the Journavx was not enough, they can always take ibuprofen. That's basically how the study went. Okay. And the safety profile was evaluated as well. The most common adverse reactions in study participants who receive, actually, let me read that. That's important. The safety profile of Journavx is primarily based on data from the pooled double-blind placebo and active control trials in 874 participants with moderate to severe acute pain following abdominoplasty and bunionectomy, with supportive safety data from one single-arm open-label study in 256 participants with moderate to severe acute pain in a range of acute pain conditions. The most common adverse reactions in study participants who received Journavx were itching, muscle spasms, increased blood level of creatine phosphokinase, and a rash. Journavx is contraindicated for concomitant use with strong CYP3A inhibitors. So basically, CYP3A is an enzyme in the liver, and there's a lot of medications that basically either activate it or inhibit it. So this is saying that you shouldn't use Journavx if you're on any of those medications. Additionally, patients should avoid food or drink containing grapefruit. Yeah, classic grapefruit with CYP when taking Journavx. Okay. Yeah, there you go. So, and then on their website, there's a lot of information, but none of it is. One second. Okay, here you go. So this is on the official Journavx website. So how does Journavx work? So Journavx is a non-opioid medicine that works in the PNS, or the peripheral nervous system. The peripheral nervous system is a part of your nervous system that lies outside your brain and spinal cord. It sends information throughout your body to and from your brain. Journavx targets a specific nerve channel in your peripheral nervous system called NaV1.8. So sodium subscript V numbers 1.8. When Journavx targets this specific channel, pain signals are reduced before they can reach the brain. Journavx works on these sodium channels, which works on sodium V1.8, which is not expressed in the brain and is not related to addiction. Journavx does not affect other tissues in your body outside of your peripheral nervous system. So, what's really coincidental is that back in high school, I used to be part of this program called STAR in Los Angeles, and I actually worked for a lab at the USC Keck School of Medicine, and we actually used to, create, or rather, we didn't create. You don't really create things, right? You just express things. So, like, we would express certain protein channels in frog eggs. So in Xenopus laevis oocytes. And so we would test different channels. So we would test sodium channels, potassium channels, and we would basically see, okay, like, are these usable in testing? Because we don't want to use animals, right? Like, we want to move away from animal testing for all these drugs. So we would just create these, like, just empty frog eggs, which would they're not life forms, they're just empty cells, right? So these empty cells would produce different channels, like sodium channels, etc. And then you can give them different medications and just see what happens. And we would basically measure, like, voltage and, like, just electrical differences. So I think that's probably what they did in order to discover this medication. It's like, wait a minute, like, this chemical, like, it's acting on this very specific protein channel. Where is this protein channel? Oh, it's in the peripheral nervous system. Okay, like, what does that mean? What are the applications? And then some very smart researchers figured out, like, wait a minute, like, we can reduce pain in humans. And because this is all in the peripheral nervous system, it's not in the central, so like the brain, the spinal cord, your brain is not going to release, I'm assuming it's not going to release, like, pleasure neurotransmitters, right? Like dopamine, serotonin. So this is just a pure pain medication, just like Tylenol and Advil. Like, it doesn't go to your brain at all. Um, so again, as usual with my videos, like, just like my Cobenfy video, if you watch it, and I will be producing an update video very soon. It's gotten I think it's at like 5,000 views right now. So thank you so much, everyone, for watching that video and commenting and liking it and sharing it. And I will be making an update video to that, because as of today, like, there actually are updates. So like, I remember when I made that Cobenfy video, like, it was brand new. Like, literally, like, us doctors, like, we get news from, like, directly from the FDA, the CDC, the WHO. So and I just like sharing that with the world. That's why I made this YouTube channel. But yeah, so what are my thoughts on Journavx? So I personally am extremely optimistic. Like, I'm not cautiously optimistic. I'm extremely optimistic about this medication. And the reason why is because it's twofold. Like, number one, there are a lot of diseases where patients cannot take NSAIDs like Advil and naproxen. And there are a lot of diseases, like liver diseases, where patients cannot take Tylenol or paracetamol, acetaminophen. And so in these situations, what was left? It's opioids, right? So, obviously there's physical therapy, there's massage and all that good stuff, but there are some pains that are so severe that we do need some sort of medical management. And so if NSAIDs and Tylenol do not work, unfortunately we've been having to give opioids, Um, I personally, I think I said it in like one of my past videos, but I've always been anti-opioid. So like I would teach my patients like self physical therapy, exercises, massage therapy. I would actually send them over to like other modalities before ultimately prescribing them opioids, simply because it's so dangerous and the addiction profile is just it's too great for me for my comfort level. So Journavx is extremely welcome because I would say like the great majority of physicians like we hate opioids like we hate them like it's like it's sort of like a necessary evil to treat people's pain because pain is not good like a lot of us are lucky enough that we've never had severe 9 out of 10, 10 out of 10 pain and again like you like even even like stubbing your toe or something that's like a 2 out of 10 like realistically, right? So like there are pains that humans have experienced and are experiencing that to most humans it's like incomprehensible how much pain that is. And a human should not be in pain because then your cortisol increases, your blood pressure might skyrocket, you might get tachycardia, dyspnea. Um, and that's why pain is control. That's why we try to control pain, especially chronic pain, because like you can't sleep. You get multi-organ dysfunction if you have chronic pain. So I'm very optimistic about Journavx. Like it's been FDA approved, um, so it's check that out. So on the website it states Journavx is expected to be available around mid-March. So that's actually right now, isn't it? At major national and select regional retail pharmacies. So this isn't an ad or anything. I just get news and I like to share it with the world. So but yeah, this is extremely it's extremely I'm extremely optimistic and I'm happy that finally there's another modality. There's like another pain medicine other than Tylenol and Advil. And opioids are just yucky and like I hate like addiction is something that we really need to like I'm talking to fellow physicians like think twice before you order morphine. Like I know that part of our admission orders is just to give morphine, right? So but again you are a physician like and I think a lot of it is accountability. It's like we took the Hippocratic oath, like I'm calling all of us out including myself, right? So we have to do that, like we're professionals, like we're so it's like before you just automatically give like Dilaudid to somebody, even if someone's begging for Dilaudid, right? Like double check, like, is it appropriate to give it to this person? Like, are there other modalities? So now that Journavx is here, guess what? There are other modalities. So I'm expecting there to be a huge adoption of Journavx, and I really hope that there is, and I really hope that there aren't any severe major long-term side effects. And again, we're only going to know in like 10 years from now, like once for like 10 years of human trials. Um, but this is good because again, like the way that we use opioids in the medical world is that it should only be for bone pain and cancer pain. That's it. So like a fractured bone or, especially rib fractures, or metastatic cancer pain. That's actually the only two like, peer-reviewed accepted uses of opioids. But the reality is that, and again, anyone who's ever been a patient, all of my fellow physicians who've done residency training, guess what? Like we just give opioids out for everybody. And a lot of our attending, like it's kind of like why do we do it this way? Simply because we were told to do it. And like stop and think like why are you doing like why are you doing this and what are the implications of what you're doing? And I think that's what separates a good doctor from like a robot doctor who just follows orders. Um, but again, if you are a patient, remember, again, watch my videos on patient advocacy, but you are in charge of your health, okay? Don't ever think that you're not. Like the Hippocratic Oath, basically, the number one thing actually is patient autonomy. So, if someone, like nurses and doctors have to tell you exactly what they're ordering, what they're giving you, when they're going to, do a procedure. When you're about to do a when you're about to get a surgery or something, make sure you asked for the informed consent form and you actually read the whole thing. And ask questions to your physician. And again, like part of our job is to explain, it's to educate, right? Anyway, so this video was on Journavx or Suzetrigine. I'll link the resources below. Thank you for watching if you made it to this end, all the way to this end. And if you do have any questions or if there are any other topics that you'd like us to discuss, please, again, leave a comment below. Like and subscribe. We're still a new channel, so we're growing, like, thankfully. But like, we'd like to reach as many people as possible. But again, thank you. This is Dr. Nahim Mizan, and until next time, take care.